Okay, well, I'd like to welcome you all. I'm Michael Green. I'm the President and CEO of Canada Health Infoway. I've been in the role since August last year, so now I'm pretty much a veteran in the role. And this is my first peer leader conference or symposium, so I've been looking forward to it. And I came along yesterday and saw the posters, which were really good, and had the opportunity to look at a few of those. And then also after that, at dinner, we had a speaker from Australia who obviously was so reticent about coming here with our weather that he decided to do it by conference call. But that worked very well, and it was really interesting to see, the different kind of programs that they were putting in place in Australia, and also, in fact, how a lot of the issues there, particularly with Indigenous population and so on, and the distances and everything else, and chronic disease, are very similar to the ones that we see up here in Canada as well. So I'm going to talk a little bit about Infoway's engagement strategy that brings together clinicians in leadership, practice and education to ensure clinical value is achieved in digital health. This strategy supports clinicians and other members of the healthcare team in the ongoing adoption and use of digital health in Canada through investments in a number of different areas: modern point-of-care solutions, peer leader networks, clinician in training initiatives which help prepare the next generation to practice effectively in technology-enabled environments, and also change management tools and resources. Infoway also engages clinicians to provide us with advice on projects and strategy. And I want to sincerely thank all of you for your efforts, whether you're a veteran reference group member who has been at this since the early days of clinical engagement strategy, or whether you're a new peer leader just starting out. I want you to know that our commitment and engagement, and your commitment as well, is extremely important to us. As a peer leader, you're providing your colleagues with support and education they need to advance the effective use of technology in clinical practice and improve the patient experience for Canadians across the country. So thank you very much for your leadership and impact in this respect. Starting with last night's learning session dinner that I mentioned earlier, we've developed an agenda for this year's symposium that we hope you'll find interesting and informative. The goal is to provide you with some insights as well as some practical information and tools that you'll be able to use when you return home. We also want to acknowledge the clinical leadership that is occurring across Canada, and in a few minutes I'll be presenting some awards. And last but not least, we hope you'll see this symposium as a chance to network with new colleagues and reconnect with others you may not have seen for a while. So Canada's health ministers have recognised the progress that's been made in digital health in Canada. After their meeting in Banff, Alberta last September, the provincial and territorial health ministers issued a public statement that said, "Electronic health records are one of the most transformational innovations in healthcare in a generation." So just how transformational are they? We know that across Canada, patients, their families, and their clinicians are experiencing the positive effects of innovations in digital health. And I'd like to give just a couple of examples. Kevin Lowe of Coquitlam, BC, calls his province's My eHealth patient portal a literal lifesaver. He says that by seeing all of his test results online as soon as they're done, he has a feeling of empowerment and control over his own health, and it saves him needing unnecessary follow-up trips. Donna Waterman of Edmonton, Alberta, says saving time was critical when her father ended up in emergency a few years ago. Clinicians immediately had access to her father's test results, and they were able to quickly diagnose his cancer, and treatment was started within a few days. Alex Summers is a resident in the emergency department at St. Michael's Hospital in Toronto. The hospital's EMR allows him to record patient information that's accessible to his colleagues when needed. He says it allows healthcare providers to make much more educated, appropriate clinical decisions when dealing with patients they've never seen before. Patients that they've never seen before. So he sees the EMR as something that's absolutely crucial to emergency care. So the benefits these patients, caregivers and clinicians are experiencing are hard to quantify. In some cases, they're immeasurable, like trying to put a value on peace of mind from getting test results so quickly. so diagnosis and treatment can proceed and happen in a matter of days rather than weeks or months, that's so often the case. But there are also benefits that we can quantify and measure. So looking at EMRs, we've got some very positive news when the results of the 2014 National Physician Survey was released late last year. The results there showed that 77% of family physicians in Canada are now using EMRs. And that number has tripled since 2007, which is quite an achievement. Also, the survey showed that 70% of family physicians reported improvements in the quality of care that they're delivering, and that was up from 63% in 2013. So the work of clinical leaders has been key in achieving these results by educating your colleagues about the benefits of EMRs and also encouraging use, not only basic use, but also advanced use as well. You're helping clinicians make their practices more efficient, and you're also helping them improve the quality of care they provide. When Infoway established the peer leader program several years ago, this was exactly the kind of result we envisioned. Clinicians learning about the benefits of digital health from their colleagues, the early adopters who are leading the way and eager to spread the word to others. In total, Infoway has created and supported 11 peer leader networks across the country, and that engages more than 350 peer leaders and 10,000 colleagues of theirs are involved in the programs. So besides providing this pre-implementation advice to community-based clinicians who are considering implementing an EMR, peer leaders are also mentor nurses, pharmacists, physicians, and office staff, and looking at how to advance clinical practice through technology. We also recently established a peer leader network. This network builds upon our next generation clinicians in training program and is leveraging our existing peer leader network model to provide support and mentorship to the academic community. So far we have active faculty peer leader networks for pharmacists and nurses in partnership with the Association of Faculties of Pharmacists of Canada and the Canadian Association of Schools of Nursing. And discussions are also underway with the Association of Faculties of Medicine of Canada. We've made tremendous progress on digital health over the past few years, but where do we go from here? And where do patients and clinicians fit in? A few weeks ago, we released our summary corporate plan, essentially our business plan for 2015-16 fiscal year. This outlines 3 key objectives or priorities. First one is improving the continuity of care as patients transition to different care settings. Then bringing care closer to home through the use of things like remote patient monitoring and consumer healthcare solutions. And then finally, supporting clinicians and patients in adopting and using digital health solutions. We believe that clinicians and patients have a role to play in achieving all 3 of those objectives. And with your leadership, I've got no doubt that we continue to make progress that will benefit clinicians, improve the patient experience for Canadians, and contribute to a high quality and sustainable health system. Everything I've talked about has touched on the theme of this symposium, which is Patients, Clinicians, Partnerships. I'd like to ask you to take that theme to heart. A true partnership between patients and their clinicians will benefit everyone. Some clinicians are already moving in that direction, but for others it may take more time. During the program today, you're going to hear a lot more about how we can achieve this desired future state. And in a few minutes, our morning keynote speaker will take to the podium. Regina Holliday will use her story and her art to talk about the importance of a patient-centered approach to care and the sharing of information between patients and providers. After the morning break, you'll hear from a team representing Ontario Shores Centre for Mental Health Sciences. They're going to give us an overview of how they implemented an integrated health plan. And then after that, we'll hear more about e-integrated healthcare plans from Megan Tam of Harris Decima, who will present findings from patient focus groups. She'll be joined by Tazim Virani, who will present findings about the current state of e-integrated care plans and key jurisdictional initiatives underway, both in Canada and also abroad. Then after lunch, we'll have a working session and live polling to get your perspectives on advancing e-integrated care planning. Finally, our closing keynote speaker, Corinne Sandler, will share best practices and talk about how new data technologies can transform our thinking. So I think it's a great agenda, and I know you're looking forward to it as much as I am. So with that, I'm going to conclude my opening remarks this morning. And thank you once again for all of what you do to improve the health of Canadians. Thank you. Okay, so I'm going to stay here a few more minutes. So I've got the pleasure now of presenting some awards. And first of all, appropriately, it's an award that is the first of its kind. And this is the Faculty of Interprofessional eHealth Award, which was established in partnership with the Association of Faculties of Medicine of Canada, the Association of Faculties of Pharmacy of Canada, and the Canadian Association of Schools of Nursing. So this award is a component of Infoway's clinical engagement strategy, Next Generation. It's designed to recognize a faculty who demonstrate exceptional leadership and commitment to teaching patient-centered interprofessional education that's enabled by digital health solutions. The selection panel was made up of representatives from Infoway and our 3 partner associations, as well as the Canadian Interprofessional Healthcare Collaborative and previous faculty eHealth Award recipients. Teams that made submissions were required to demonstrate a commitment to an integrated healthcare model that brings together professionals from different disciplines and focuses on patient-centered care. So I'm very pleased to announce that the team that has been selected for this award is the team from the University of Saskatchewan in Saskatoon. And team members include Dr. Jill Bally, Assistant Professor, College of Nursing, Dr. Shelley Spur, Assistant Professor, College of Nursing, Dr. Lorna Butler, Dean, College of Nursing, Dr. Alyssa Hayes, the Assistant Professor, College of Dentistry, Dr. Shahab Khan, the ophthalmologist of the College of Medicine, and also Mr. Mark Tom, Director of Information and Communications Technology. As you can see, this is a wonderful example of collaboration amongst very different disciplines. Let me give you an overview of what this team has done and achieved. So children living in northern Canada are receiving preventative health, vision and dental interventions they need thanks to this team's innovative program, which is called Northern Caring for Kids Where They Live. This program provides educational opportunities for healthcare students to deliver care in northern Saskatchewan using digital healthcare solutions. By connecting northern clients with urban-based dental and vision health professionals using telerobotics, students in nursing, medicine and dentistry learn to communicate across disciplines and distances to provide a high quality of service to children. This program is advancing efforts to address the needs of underserved, vulnerable, remote populations who experience health inequalities, and it's providing more timely access to care and reducing wait times for health referrals, assessments and care. So please join me in congratulating the team from the University of Saskatchewan on receiving the 2015 Faculty Interprofessional eHealth Award, and would representative of the team please join me to receive their award. Now, a few years ago, as part of the clinical engagement strategy, Infoway established the Knowing is Better clinician education campaign to generate awareness of the benefits of using technology in clinical practice. With your help, the campaign was designed by clinicians for clinicians. As part of this campaign, we developed a national leading practice initiative last year in partnership with Accreditation Canada and with the support of the National Healthcare Associations. We wanted to identify and recognise leading practices across Canada that demonstrate how digital health is being used to strengthen clinical practice and improve the patient experience. The initiative was so successful that we've teamed up with Accreditation Canada again this year to recognise leading practices from across the country. Submissions were reviewed by a selection panel made up of representatives from Accreditation Canada, the Canadian Medical Association, the Canadian Nurses Association, the Canadian Pharmacists Association, Healthcare Can, Infoway, and Infoway's Clinical Council and Reference Groups. Many thanks to all of you here today who participated in this process. In the end, 6 organisations were unanimously identified as having leading practices, and we were very pleased to recognise them now. So I'd like to ask Wendy Nickling, President and CEO of Accreditation Canada, to join me to present the awards. And I'm going to read a brief description of each organisation's leading practice, then ask representatives of that organisation to come forward to receive that award. And it's in no particular order. And then at the end of that, I'm going to ask you to remain up here at the front, and we're going to take a group photograph. So the first award goes to Alberta Health Services. Alberta Health Services exemplifies a model of care that is focused on improving access and continuity of care through its Path to Care programme. Services and resources are matched to the needs of individual patients using wait time targets, provincial reference pathways, and e-referral functionality, thereby improving healthcare system navigation. So please join me in congratulating Alberta Health Services on this leading practice. I'd ask the representatives to come forward to receive their award. Okay, so the next award goes to Capital Health of Nova Scotia. Capital Health is working to improve patient safety through its web-based medication reconciliation application. By interfacing with other clinical information systems and the Capital Health clinical portal, the solution enables timely access to medication and allergy information when and where it's needed. So please join me in congratulating Capital Health of Nova Scotia on this leading practice. I would ask representatives to come forward to receive their award. The next award goes to Ontario Shores Centre for Medical Health Sciences. As the first hospital in Canada to achieve a completely paperless health system, that's HIMSS MRAM Stage 7 for you in the know of that, Ontario Shores Centre for Medical Health Sciences exemplifies clinical leadership in advancing care throughout the use of digital health. The Centre's e-integrated care plans and secure patient portal promote active engagement and partnership amongst patients, families, and also healthcare providers. So please join me in congratulating Ontario Shores Centre for Mental Health Sciences on this leading practice. Okay, so now we'd like to recognise the Centre for Family Medicine from Kitchener, Ontario, with a Leading Practice Award. The Centre for Family Medicine is a family health team that's demonstrated improved decision support and information management by adopting standards such as SNOMED CT in its electronic medical record. This has enabled systematic implementation of best practice guidelines for chronic diseases, such as heart failure, and it has also created a foundation for identifying quality improvement in chronic disease management. Please join me in congratulating Centre for Family Medicine from Kitchener on this leading practice, and I'll ask them to come forward. So there were actually 2 award recipients who were not able to join us today, but I'd like to acknowledge them as well. So it's Dr. Elizabeth Sawyers of Ottawa, Ontario. She's a solo primary care practitioner who understands the value of digital health in improving collaboration and communication. She uses electronic health medical record and participates in the e-consult service. So Dr. Sawyers has increased collaboration and communication with other providers. She's also helping her patients with better access and better care by offering e-booking and secure messaging. And then the other winner was Health Sciences North, Emergency Department of Sudbury, Ontario. And they demonstrated improved clinical decision support and efficiency by making structured charts from its EMR available to clinicians practicing in a hybrid environment. This innovative transitional strategy has resulted in significant time savings for emergency department physicians, and it's also helping them move towards complete electronic documentation. So in their absence, I'd like to congratulate Dr. Sawyers and also Health Sciences North. Okay, so these are great and fantastic examples of how digital health is strengthening clinical practice and improving the patient experience in Canada. So after that, we'd like to also thank Wendy. I'd like to thank Wendy and Accreditation Canada for joining us as a great partner in these awards, and we look forward to continuing with our work with you.